Hey guys, I'm Dr. Paul Lynch. I'm a pain management physician and an anesthesiologist, and I live in Scottsdale, Arizona. Now, for anyone that knows Scottsdale, you could say this is the golf mecca of the country. We have more golf courses than people. I think that's a true fact. More golf courses. That may not be true. I saw that on Wikipedia. Yeah, more lost golf. We have golf courses everywhere. When I first moved to Scottsdale, I'd actually really never played golf and decided I better pick it up. We have like 450 days of sunshine a year. Does that sound right?
I think it's a little low.
We have sunshine every day. We can play golf in January, February. We can play golf on Christmas Day. I know because I do. And so a lot of our players, or a lot of our patients are golfers. And so I had to figure out golf pretty quick. And for some of you guys that follow me on social media, my kids have become golfers. And so I love my kids. I'm always trying to coach them. So I've had to learn a lot. I sent out actually a post this morning, and I showed a picture of my son. And I think we're going to put that up in a minute. And I thought it was like a beautiful, amazing swing. This was like 3 years ago. And I showed it to several of my friends, and they're like, yeah, that's a great swing. And everyone, you know, it's like showing someone a baby picture. You can't say someone's baby's ugly, right? Yeah. So I showed everyone, and they told me how great my son's swing was. So there we are. And I thought it was amazing. And I'm a photographer, and he just looked all kind of cool. And I was like, this is amazing. And then I showed it to Scott Watkins. And Scott, who's sitting here on the far right, is a former PGA golf pro. He's an All-American at Arizona State, amazing golfer. I showed him, and he said, you know, it's a good looking golf swing, but he's going to end up hurting himself. Is that what you, something like that, right? Exactly. And I mean, I'm a pain doc, so I don't want to hear that my son's going to hurt himself. And so Scott and I started this dialogue that led to him coaching all my kids. And by the way, about the same time, I was talking to Mark Williamson, who's also a former professional golfer. And Mark's basically said the same thing, that, you know, having a pretty swing and a powerful swing, and I'm kind of putting words in your mouth. I'm going to let you say it.
It's pretty close.
But pretty and powerful is great, but what you want a swing that's built to last, right? Long term. So we're not going to go too much into depth right now. What I want to do is tease this for you guys that tonight, over the next 30, 45 minutes, maybe an hour, we want to have some PGA professionals, some fitness performance coaches. We have a chiropractor, Dr. Chance Moore, that's here. We have a nurse practitioner, Bea Salvanera, who works with me every day in the clinic seeing patients, and me, an interventional pain doc. And we're going to kind of talk about golf swings. We're going to talk about how to protect yourself. And then we're going to talk about if you do get hurt, what you can do. And then at the very end, we're going to take questions, and we'll stay here all night if we have to. We have about 20 or 30 minutes, you know, probably at the end where we can just take questions. So Austin, what's the best way to tell them to put in questions? In the chat box?
On Zoom or on Facebook?
Okay, if you're on Zoom or Facebook, you can just put questions in directly, and we may not get to it immediately, but we're going to pull out some of those questions and answer them at the end. So with that, we're going to start with Scott Watkins. We're going to go over to the simulator, and as we're transitioning over, we're going to show you Tiger Woods and his famous swing, and how sometimes it can lead to pain.
This is 40 yards, maybe 50 yards up.
It literally hurts me.
Yeah.
Wow.
I cringe.
Well, we're able to spasm that.
Look at that one or look at you?
No way.
Okay, so we've all been following Tiger and his wonderful career where he's won 15 majors and 82 wins or 83 wins. But one of the first times I met with you 3 years ago, you told me that this injury was predictable. Tell us a little bit about your approach to the swing.
I use digital video equipment, and back in 2000, I had video of so many tour pros, but there's one follow through I saw on there, and I just said, if Tiger Woods doesn't catch Jack Nicklaus in the major championship run, it'll be because of his back. And I didn't know that 21 years later he'd have 5 back surgeries and knee surgeries as well in a car accident, but that's pretty much what slowed it down. I mean, if he didn't have the back problems, he probably would have passed it easily.
Right, probably the best golfer that we've ever seen.
That's debatable.
but his the thing that made him great also ultimately hurt him.
Right.
The velocity, the ferociousness with which he went after the
Right.
ball.
I mean, you know, we played with more finesse back when we grew up in
Yep.
the woods and wound balls and deep grooves and all that. Now it's more of a power game.
Yeah.
And, you know, there's just certain things that you can do to create power, but you have to learn how to stop it.
Right.
And through Tiger's whole career, there's no golf instructor that ever approached him on
Right.
how do you stop the club once you create the speed
Right.
without hurting yourself. And what he's done is he's hurt himself because he spins around too far. A couple other things.
Let's bring in our model here, and what we're going to have. So Scott is one of the best instructors in Arizona right now, and he works. What's really amazing about what he's able to do is he teaches you how to create power without injuring yourself. And he kind of talked on a little bit there. It's not just creating the power; it's being able to stop it appropriately. So Scott, what I'd like you to do is just show us 3 or 4 things that you're doing with a player to help them create that power but not injure themselves.
So for a lot of you that already have really bad back problems, I mean, one of the first things I do when I meet a golfer is I go through a little interview, ask about shots, clubs, and all that. But I also ask about any physical injuries because I got to know in advance if I'm going to ask you to do something if it's going to aggravate an existing injury, or if you don't have the flexibility to do something, I
Right.
can't help you do anything until you get the flexibility. And that's where someone like Mark comes in. For those of you that do have bad backs, the first thing I see them do is they stand there flat-footed the whole swing, trying to turn their shoulders and swing their arms. But if you don't move your hips,
Right.
turn them. Now the spine is taking the whole torque
Right.
because the shoulders are still turning and the hips are totally immobile. For the younger kids that have grown up in the Tiger Will, you're not in the Tiger Woods era, but the swings that you see today, a lot of them have an influence from Tiger swing, and long term they're going to get hurt.
What do you mean by that? Influenced by Tiger swing?
Well, it's the wide stance, the wraparound follow through, the right leg is straight in the back in the follow through. There's just a lot of things.
A little bit of what we were showing the picture of Alex.
Exactly
Can we just put the picture up again? Because we may use as an example of a little bit what not to do.
If you look at, well, when it comes up. So, you know, his right leg is straight.
Okay.
So his femurs aren't lined up. So his right glute or butt cheek, let's say, in the lower right back, all those muscles are tight.
Got it. So his right leg is straight. You can see the knee isn't bent at all.
Correct.
And that's bad.
And a lot of times it comes from the stance being too wide.
Got it.
So throughout my whole career,
His right leg can't get even with the left leg because it's too far back.
Stance is too wide.
That makes
Unless
sense.
it's right foot drags.
Got it.
So throughout most of my career, or that I played golf since early 70s, all you ever hear about is the width of the stance where the driver should be shoulder width. What does that mean? Is it the outside of the shoulders, the inside of the ankles, center joint, center joint? And to me, it doesn't make sense because we're all proportionally built so differently. And
Right.
not making fun of them, but the Oompa Loompas from Willy Wonka. I mean, they had torsos my size,
Right.
the limbs of
Right.
a third grader. So they got these broad shoulders, short stubby little legs. They have to spread those things out. They couldn't
Let's
move.
use Chase as an example. Show us what too wide would be. Set up a little bit wide for us, Chase.
So if he's that wide, there's no way his legs are long enough. And I look, you know, size of the shoe that you wear. And how
Let's
flexible
come in
that
this
right ankle.
Come in this way so you can see how wide he is, because I think it's important. So just to be clear, this is too wide. Is that right?
Right. So if you go ahead and hit it. Try to hold it back.
And stop
His
there.
stance is so wide, he can't get this knee all the way up here.
Right.
Go ahead and drag your toe. And let him
Without
back.
doing that. Right.
Now, if you stand right there, you straighten your right knee. You just tighten up.
So when it's straight like that, where is it putting the pressure? On the low back or the buttock or both, the
Right
hamstring?
butt- yeah, right butt cheek and the lower back.
Got it.
So
Now-
I have my students try to finish with a straight front knee, because I'm right-handed, and try to get the kneecaps almost as even as they can up there.
That makes sense. And that's less pressure on the low back,
Right,
less
so as
pressure
soon-
on the
as soon as
leg.
I do that, I can just go all this tight up.
So show how wide he should be in the correct swing.
All you really have to do is just spread your feet out, and pivot forward, and this knee straightens, and push that knee as far forward as you can without dragging it.
I need
So,
a pickup call.
and you know, with a driver, I might give someone a couple inches shy of that, but not much more than that.
So show us the right way to do it, Chase.
The second patient doesn't have any weakness, just ridiculous. Their patient has weakness.
So this isn't too bad.
Weakness.
In a perfect world, like you ride the railroad spike, there's not the same spot on the other. Keep in mind.
And by just doing that with your stance, you're going to protect your low back.
To a certain, yeah, well, at least with the lower body.
My guess is that most golfers have never been told that. I see weekend warriors that go out and get real wide, and you watch like the long drive competitions, right? And they get real wide and they tee it up real high and they're doing big swings and they're right, and they're hurting their backs. Okay, so that makes a ton of sense. So it's width. What's the next thing you would teach the golfer?
The next thing I look for is the forward foot. You know, Chase being a right-handed golfer, be the left foot. And it's to a certain degree, it depends on how your feet. If you got someone who's pigeon-toed,
Yeah.
you know, flaring the left toe, they can't flare it as much as I can because I'm a little slew-footed. If it goes the other way, right? But I like to see the front foot flare a little bit. But I see too many people that wide stance, right, and the front foot perpendicular, and as they get over here, the ankle, knee, and hip lock up.
And Alex is doing that wrong too, right?
Yeah, it's got to flare a little bit, but yeah.
But it's too straight, right?
It's too straight.
You can't follow through.
Can't get his hips all the way through unless the foot.
And then where does that pressure go?
Well, the foot gives loose, it probably releases.
So that's actually not even back swing, that's the pressure on the knee,
Ankle,
right?
knee, hip.
So ankle, knee, hip injuries.
There's only so much rotation.
Right. And we're not going to talk as much tonight, guys, about joints. We made a joke that the follow-up to this is we're going to do one just on joints. I don't think you guys heard this yet. We're going to do one just on joints next month, and it's going to be called How to Smoke the Golf Ball Without Smoking Your Joints. But then we thought that might not be appropriate. So we're not going to do that one.
It is.
Smoking joints, not recommended. But we're not going to talk about joints today. But by keeping that foot and showing on him what bad would look like. Show us too square of a front foot, Chase.
Yeah, go ahead and pigeon toe it in.
Yeah.
And
So
so try to keep it there in the follow through.
We don't want to hurt you. Be careful. It's hard, right? It wants to rotate.
It wants to, it'll spit out.
And so the second main point is to make sure you flare that front foot, which is going to protect your ankle, your knees, and your hip.
And you just got to play around with it. Just get it flared enough to where you can get your hips all the way around,
Right.
the right knee up to the left.
Okay. All right. So that's number 2. And then what's your third point on how to protect your back?
Well, what Tiger does, and a lot of players, Rory and a lot of these guys with the wraparound follow through is, you got a certain space between your elbows, but when they get in the follow through, they let the left elbow start to fly.
Yeah.
And anatomically, this arm can't stop all that speed because it's across here, and no longer can this one.
Got it.
So Chase, do me, just get in a follow through position for me. So I'll show you. So if he keeps his elbows together, now unfortunately I weigh 215 pounds and I'm working on that, but yeah,
I got you. Come
just
see
with
me.
your upper arms, I'm going to lean on you. Just with your upper arms, push me back. Don't use your body. Not too hard. Yeah. Okay. All he has to do is that.
And he loses his
Right. So they get these elbows separating and all this speed's coming at them. They can't stop it. So what happens? They just spin around and then it's all of it.
It's over for the low back when you do
Right.
that. So let's say that a little bit differently. You want to keep your elbows together.
they're not going to be totally
But
pinched together, but
more.
they're going to be to where this arm
Right.
is the one that's going to absorb all that speed.
And what you're really
The
trying to
bicep.
do is not over rotate.
Right.
And if we go back to Alex's picture, he's pretty
It's not
over.
too bad.
Not
but
too
that's-
bad.
That's an iron.
But that's
So if
an
he would
iron,
have cut less
yeah.
with a driver, he probably would, because you can see his left. I don't like my students to ever get the left elbow past the left shoulder.
Would you show us what over rotation looks like without hurting yourself? Let's see what an over rotation swing kind of
Maybe
looks
half
like.
speed.
Yeah, half speed. That's a good way. His mom's watching. Sorry, Pamela.
So is it
So
See how the elbow flies?
yeah, now try to hold that position again. And so that, now you see a lot of the pictures from like the 90s of Tiger, he looked like that on every
Oh, yeah.
swing, right? And show him the problem where the pressure is on him.
Well, he's doing this. I
Right.
mean, this is all already tight because that
Right.
leg is straight.
And you're twisting the low back, right?
And then, the vertebrae, the doctors can tell you, they can
Yeah.
only rotate so much.
Right.
So you start torquing.
Well, this is a good time.
Right.
We can we can get the
You can
spine
relax.
model here, and we're going to look at this a little bit later. But basically, what he's showing is as he's spinning, you're torquing the lower spine, and you're putting pressure on these facet joints, which are the little joints on either side of each vertebrae. And so we're going to talk about that later in some of our case presentation. But as you rotate, and you rotate more and more and more, if you can't stop that, the way Scott's talking about, if you can't stop the swing, then all that energy translates to your lower spine and puts pressure on these facets. We're going to talk about that in a little bit. That's a great point. So is that the main 3 points
Pretty much. It's, and if you've watched Tiger in his career, the more back surgeries he's had, the more he hits and then stands up really quick.
Okay, so make sure you're not too wide with your stance.
Right.
Make sure that your knee can get back to the other knee.
Right.
And I heard you say that you can almost drive a stake through your two knees
Right.
and they go together. That's a great teaching point there. Flare your front foot a little bit
Mhm.
so that you don't put pressure on the joints, which we're not going to talk about today. And then don't over rotate,
Right.
which is going to protect your low back.
And the front leg should finish straight.
Right.
Because then the bulk of my weight is being borne by the bones
Right.
and not, if I bend my left knee, all of a sudden, this is all getting tight. And then on top of it.
We're going to come back to you as this progresses, and I may even actually have you walk over with us. But what we're going to do now is we're going to bring Mark Williamson in. Mark was a professional golfer, former collegiate athlete, and now he's dedicated his life to performance and fitness. And so he's basically helping golfers strengthen their bodies so that they can play the game. And so we're going to take Mark and we're going to take our same athlete, Chase, if it's okay. We're going to go over to the workout area and we're going to learn some basic stretches
Perfect.
and strengthening that you can do to protect your spine. So let's go over here and I'm going to turn it over to Mark a little bit and I'll maybe ask some questions.
Sure. So one of the big things that I see with a lot of golfers is back pain in golfers generally is going to come from a couple of different places. It might be that the hips are a little out of alignment, which is where the chiropractic work comes in. A lot of what I see through athletes and of all ages is tight hamstrings. So we see a lot of tightness in the hamstrings. We see a lot of pulling right around the core, right around the glutes, all around through the hips. So I'm going to have Chase do a couple of things. And the beautiful thing is Chase is actually one of my clients I've worked with for quite a while. So I get to beat him up a little bit with this. So go ahead. I'm going to have you take it all the way down, hands and knees, Chase. And I want you to feel like you're going to get the wrists right underneath the shoulders and the knees right underneath the hips. So you can see these lines just coming straight down. So we're supported. And exactly what Scott was just saying is we're trying to stack bones on top of bones. When we stack bones on top of bones, we don't get hurt. All of a sudden, now we've got a good stable base. So these first couple that we're going to hit are called cat-cows, and they're real simple. So Chase, I'm going to have you go inhale. We're going to arch that back just a little bit. I'm going to have you look up towards me. So when you inhale and arch, start to look up, getting in those cat-cows. There you go. On the exhale, I'm going to have you tuck that pelvis underneath you and round out through the shoulder blades. So you're almost feeling like you're sending these shoulder blades high, really trying to tuck this pelvis under a little bit. So start to go with your own breath there, Chase. Take just a few of these. Inhale, nice little arch. Exhale, nice little tuck. Starting to get some movement through the pelvis, starting to feel that a little bit in the low back. So it might feel like you're getting a big stretch through the low back. The bigger thing that we're starting to get here is control of the pelvis, being able to arch and tuck, work both directions. Now, obviously, golf is a very rotational game, so we need to get some rotation in there too. So Chase, go back to a neutral spine for me, right where you started. Now I'm going to have you bring those knees and the feet all the way together to touch, kind of like you're making a tightrope out of them. So these next ones are real simple for you, and I have every one of my golfers do these before they warm up in the morning, before they go play. These are just called hip circles. So Chase, I'm going to have you drop those hips off to the right, swing those hips back around the heels, coming all the way around to the left. Now in yoga, this can be called figure eights, not just hip circles, because you want to feel like your head is going opposite where the hips are. So that's going to give us almost a little bit feeling of traction, but not quite. So we're trying to get things working opposite. You're going to get a big stretch, especially when this is out to the side, all the way through the hip here. Keep working around this way. Just going to take it the opposite direction. One thing that I'm big on with everybody, and I'm sure you see this quite a bit in the pain community as well. You do something on one side, we got to do it on the other. Trying to open the body up.
Now, just bring your viewers in. Is this more, you should be doing this a couple times a week, strengthening these muscles? Or you're doing this before you play to stretch, or both?
Both, to be honest with you. I love this before we watch the play because I like movement before we're on. People are kind of used to the whole stretch and come down here. So before we go play, we want movement. Wrestling is very dynamic. So we want some movement before we get into it.
Okay.
So Chase, you can come up on your knees there, sit up really tall. Another thing that we're really big with, like I said, the tightness that we start to feel around the hips into the hamstrings of the neck. So I'm going to bring that right foot forward for me into a little bit of a lunge. You're going to go a little angle into the shin. So Chase has done this before, he knows what he's doing. You got this little angle away. So you're going to take those hands on the quad. You're going to start to press that knee away. So the feeling is that the knee is going to go forward and the hips are going to sink down. All we're trying to hold is that right knee forward. We're trying to get through this left hip flexor, working down through the left quad. A lot of people, when they do this, they want to lean forward like they're trying to take the chest down to the knee. That's actually losing a lot of that stretch. So the deeper we get into this, the taller we sit up, And he's getting a big stretch all the way through that hip flexor, all the way through that quad. And then one that I'm big on for everybody, and this is a big place that I see a lot of this back pain coming from, is hamstrings. So Jason, I'm gonna have you shift back into that left leg. Let's straighten the right leg. So I'm gonna have that right leg out in front of you with the heel down on the ground. Just kind of like right here. There you go. You got it. So it depends on how tight you are in the hamstrings. A lot of people, if they try to put their hands on the ground from here, that knee is going to start to bend a little bit, and then we're losing a lot of that stretch as well. So if you get into this, the knee bends. I want you to sit up tall, right where Chase is here. You realize the hands right up to that quad. Now I want to move. So when we get into this, we're changing the angle of the chest a little bit, working outside the knee, inside the knee. We're rocking the ankle a little bit. You're going to feel that a whole lot of different places into that hamstring.
I'm literally having pain watching you.
Good little pops. So the big thing when you get into this, and what I see a lot with golfers, is when we get really tight hamstrings, you get this from sitting a lot during the day, sitting at the desk, not active. Our hip flexors are working all day long. We're trying to turn and move a little bit, but these hamstrings and the glutes are shut off. So what we see a lot is tightness working up into the glutes, start losing a little bit of this natural curve in our lumbar spine. And when we do that, and this is where it's made for golfers, when we start to lose a little bit of that in our lumbar spine, the rotation gets very difficult for this. When we can control that pelvis, get very neutral. Now we can rotate real easily. But if you just stand and tuck that pelvis up underneath you and try to rotate, pretty awesome.
Tell them what you told me earlier. Because you're talking about back pain. It's not back, right?
It's very rare that I have somebody who comes in that says they have back pain, and it's truly back pain. When it is truly back pain, that's when I give you a call. That's when I give a chiropractor or a PT a call.
In your opinion, where is it usually?
I'm going to tell you the biggest place I see is hamstrings. You
Okay.
see hamstrings pulling, and now this could be a little cause and effect as well. Is it hamstrings pulling on the hips?
Right.
Is it tight hips?
Right.
All of a sudden now we're not stretching.
Right.
It's kind of chicken.
So I'm hearing you right. A lot of our viewers at home that have back pain, if they can just get the fitness program, get their hamstrings stretching more, a lot of that pain's gonna go away. Is that right?
I've seen it a lot of times.
That's a hot take right there, as my son Alex would say. Do you have any more stretches for him before we go talk about some patients?
I'll tell you what, I've got one more. I'm going to have you lay on your back real quick, Chase. This is fantastic. And I'm big on, and again, we're getting that hamstring stretch in there. A number of different ways to do that hamstring stretch. You can stand straight legged, sway around as well. But I want to show you something, particularly for golfers, because we also see a lot of tightness in the piriformis. When we
Right.
get into the glute.
Yeah, yeah.
So Chase, I'm going to have to take the right over the left knee. So this is a simple figure 4 stretch. For a lot of people, this might be enough. And this is really intense. You can slide this leg out a little bit and take away some of the intensity, work that left leg down. If this is too bad, Chase, I'm going to have you walk that left foot up just a little bit.
And which muscle group is this working?
So we're trying to get into the glute on the right side. Here.
Okay.
So we're getting a
Yeah.
little bit glute, we're getting piriformis.
Got it.
If you've got super tight, you're going to feel it there as well.
Okay.
So it's not just this one spot. We're trying to get it all the way through. And basically, everything into the piriformis as well. Anything tight, kind of working up in there.
Okay.
If this is too bad for you, if this feels pretty comfortable, you can start to press this right knee a little bit. You can also reach, just like that right hand through that triangle, reach behind that left hamstring there. Start to pull that towards you a little bit, and I guarantee you're feeling a pretty good stretch right there.
Yeah.
So again, it's a little bit of moving. You're not just going to get it in hold. You can kind of rock through this, play around. You can shift the heel a little bit, play around. Wherever it feels good. I tell everybody, every stretch, every yoga pose you ever do, you should be able to relax in it.
Right.
This is getting into it. You can stick to 70%. And the easiest way to stick to 70 is if you are having a conversation with me, you should be able to keep having that conversation just like we're talking right now. If Chase gets into this and I go, hey, Chase, how's that feeling over there? And he's like, it's not bad. It's a little tight over there. We're way past that 70, and we're actually not going to get as much release as we would like to get from these stretches. So going through it nice and easy, sticking to that 70%, going to get the body to open up a little bit, respond.
In the segment, look, we have all this workout equipment behind us. And, you know, when you first started working with the boys, I was like, okay, when are we going to lift the weights? How strong are they going to get? And the reality is, most of the time, this is where the work's done.
Yeah.
It's not a ton of weights that you're doing. It's learning to move your body. It's strengthening your core, right? This is something you guys can all do at home without any fancy equipment, right? It's just learning the technique.
Absolutely. And getting to where the body's moving properly. I'm never going to throw a load on anybody when we've got a lot of issues in there with how
Right.
we move. You move very well, you build some strength, great. That's where the weights come in. That's
Yeah.
where a lot of the power and explosiveness is. But that's after we've learned how to move properly.
Makes sense. Okay, let's go back over here. We're going to do a medical section now.
So you've learned a little bit about what your swing should look like, what you can do to prevent injuries. You've even learned a little bit about how to strengthen your core, how to get your hamstrings moving. What we're going to talk about now is what if you're injured? So I want to come over and have a conversation with some of our medical professionals from Arizona Pain. And Mark, feel free to join us as well. And Scott, I know you see patients every day that get injured. So I want to kind of have all of us talk about this a little bit. If you're watching on Zoom or on Facebook and you have questions, it's a good time to start to put in some questions. We're going to go over 3 patients the next 10 or 15 minutes, and then we're going to take your all's questions at home as we wrap up. So I work with Bea at Scottsdale, a clinic for Arizona Pain. Thank you for joining us today.
Thanks for having me.
It's nice to have you. And we also work with Dr. Moore.
Hey.
Dr. Moore is actually my doctor. I'm kind of scared of doctors personally with the doctor, but I go to Dr. Moore and he's been treating me for years. What we decided we would do is we would talk about 3 patients that Bea has seen in the clinic, and she's going to present them to me, and we're going to kind of debate how we're going to treat them. And we broke it up into mild pain, moderate pain, and severe pain. And so we want to go through some of that. So there. But what we're going to do, should I just describe the part about the patients again? How much of that do we get, Austin?
Just start over from when you started.
Okay, so, all right, so sorry for the audio difficulties there. We're going to talk about 3 patients now. I'm joined by Bea Salvanera, who works with me at Arizona Pain in our Scottsdale clinic. Bea is a nurse practitioner. You want to say hi to our audience?
Hello, audience.
Thank you for joining us. And we also have Dr. Chance Moore, who is a chiropractor, our lead chiropractor for the last 15 years. Hello. Thanks for joining us. So we're going to talk about 3 patients, one that has kind of mild pain, one that has moderate pain, and one that has severe pain. And we're going to go through real patients that we've seen in the clinic just over the last couple of weeks. So Bea, why don't you start with one of the patients you saw last week?
So the first patient we're going to talk about is a young athlete. He can actually hit the ball. He can swing the golf club pretty well. But sometimes, you know, pain happens. He has his off days, particularly for him when he swings it a little bit too hard and too fast. He gets this lower, like lumbar back pain, just kind of right here.
Off to one side?
Yes, off to one side.
Okay.
There's no radiating pain, no weakness, and kind of just like sits there.
Okay. Does it ever go down to the foot?
No.
So no numbness or tingling, no weakness in the leg or anything?
No weakness, no numbness, no tingling.
So that's a good patient to start with. It sounds to me like it's in the chiropractor's area, maybe facets. Dr. Moore, what would you do with this patient?
No, absolutely. And that's probably one of the most common things we see. You know, unfortunately, the general population, there's a large prevalence of low back pain. You know, just being a 2-legged creature, there's a lot of compression there.
I like that 2-legged creature.
And, you know, unfortunately, most people's swings that are here are not pristine, right? I mean, you see Charles Barkley, you see some of these guys, like it just looks a little spastic. And so what happens a lot, like Scott was showing, that right-sided facet, when you're coming down, it really gets overloaded. And so oftentimes the patient's coming in trying to avoid the pain.
And this patient had pain on the right.
Yes.
That's
Yeah,
interesting.
and so they're usually a little bit, we say antalgic. So they're trying to not bear weight on that right-hand side. And so,
wow. I think I do this.
yeah, no, yes, you do. So, but that facet joint pain is probably one of the most common things that chiropractors see. And so when you hear those joints move, it's oftentimes what's happening is they're overloading that facet to a point where it gets stuck. It's not out of place or displaced, but it gets stuck in that range of motion where when they try to move it, then it gets painful. So you get secondary, inflammation and muscle spasm. And so there's a lot of things that, chiropractic can do and that we do in the office here in Scottsdale. One of the big things is like traction or decompression.
Right.
And it really
did
helped.
that today on me.
Yes, we did.
If I disclose,
No,
I
I
was
was
certain,
certain,
right?
But that helps unload those facets. Then also the traditional, there's a wide spectrum of different types of spinal manipulation and some of the
Right.
that you see on other YouTube videos where, the crack.
But it's evidence-based, right?
Absolutely. It works. Yep. It works to restore motion and reduce the pain. There's a lot of other modalities that we'll do, but those are the most common for that type of pain.
Yeah, and this sounds like a pretty mild patient, but in all honesty, I still like to see these patients myself. I like to talk to them, make sure that they have good strength, good reflexes, make sure that I kind of sign off. At Arizona Pain, we do something called basically medically supervised chiropractic. So that patient that you're talking about, I would probably send right over to Dr. Moore, but I would get involved, just give a little bit of my thoughts. One of the thoughts that I give is everybody pops ibuprofen, right? Ibuprofen. We see that all day. Ibuprofen is a terrible drug on your stomach. It's bad for your kidneys. It can be bad for your heart long-term. So every patient that tells me they have pain where they take an ibuprofen even once a week, I'll give them Celebrex instead. And it's a prescription drug, but it's super cheap and it's better on your stomach. It's better on your kidneys, right? We're writing Celebrex all day long. So me, the only thing I might do for this patient is give him Celebrex and send him over to you.
No, absolutely. And like you were saying with the Celebrex, how often do we see someone come in who's self-medicating with ibuprofen? They go, I got this burning right here, and then my back pain hurts. It's like, we know where that's going, and we get that over to the primary care for that. But it's something that we see, and it's ibuprofen is not just something where there's not side effects, and so you have to be cautious of it.
So let's go to the next patient. Let's say someone that's a little bit worse. Have you had someone that's maybe worse than that first patient, but not totally severe?
Yes, we have plenty of those. You know who you are. You guys are the snowbirds. Particularly for this patient, he's a 60-year-old male, so he actually moved out here from Idaho. He retired early just to move to Scottsdale to play golf.
Wow.
Now, his issue is that he has pain that travels from his back and down to his leg.
All the way down to the leg.
All the way down to the leg.
Okay. And it sounds like we need to get an MRI on this patient. Did you get an MRI?
Yes, we have.
Okay.
So it did show some disc bulging.
Okay. Do you remember which level it was at?
I want to say L5S1.
Okay. And where was this pain in the leg?
It goes all the way down to his foot.
Down to the foot. So that makes a lot of sense. So we call it a dermatome, which is where you feel pain and where that lines up with. So L5S1 is where the L5 nerve root is. In the L5 nerve root, you'd have pain in the outside of your calf, and you may have pain in your foot. So it sounds like that's what this guy was dealing with. And the MRI said it was like a big herniation, or it was just a bulge?
Just like a disc bulge.
Like a disc bulge. Okay. So this is an interesting case too, where Dr. Moore could help, right? But this starts to kind of get into my area where I might be more inclined to do an injection or do a procedure. So let's start with you again. What would you be doing for someone without radiating pain?
Yeah, and that's where we really co-manage. I think the big thing that we assess neurologically is that there's not any what we call hard neurologic deficit.
Yeah.
So there can be pain going down the leg, and that's always a concern for us. But the first thing that we always assess is to make sure that the reflexes are intact and there's not any neurologic weakness from the extensive pressure on the back on that nerve.
Right.
Once we've excluded that, we have a window and we have different treatment options. And so similar, that decompression traction is a great treatment for that. We'll also look at some muscle work. And again, back to the modalities, but that's where I would kick them back to you.
Yeah, and this is where some of my skills, and honestly, with the first patient, I probably should have said this, when your facets go out, if it goes from mild to moderate or severe facet pain, we can actually help with that too. We can do a classic facet injections, or we can block the nerves that go to the facets. They're called the medial branches. And for people that are really severe, we can do a procedure called radio frequency ablation. So a lot of my patients watching at home, we've done that procedure on. But for these patients with bulging disc or herniated disc, the classic treatment's an epidural. But this is a good time for me to teach my 5 steps for a good pain doc. So any patient who's come to see me has heard this. Bay has heard this 100 times, Dr. Moore. So here's my 5 steps. Good diagnosis, medications, even if it's just Celebrex. Like if you come to a doctor like me, I want to make sure you're taking the right medications. And since ibuprofen is the wrong medication, I want to get you on the right one. So medication, this one's interventions like procedures. This one's hands-on therapy, which is Dr. Moore. This one's other, which just gives me an opportunity to brainstorm a patient. So for this patient, number 1 on diagnosis, I get an MRI. We'd look to see how bad the bulge is. Number 2, if there was any sense at all that there was nerve damage in that leg, if there was a decreased reflex, if there was loss of sensation, or if there was weakness, then I would order an EMG. And we do those at Arizona Pain. We do them in-house. We can get them done pretty quickly. It's almost like an EKG for your heart, but we do it for your legs to see if you have any kind of nerve damage. So I have a pretty low bar to order that because I want to know if something's going on. On medications, I try to get patients on low-risk medications like Celebrex. There's a drug called gabapentin that costs like $3 a month, and it treats nerve pain. And so what's great about gabapentin is it's super cheap, it has low side effects, and patients can take it at night and help them sleep better, but also have less nerve pain. And so these patients that come to me and say, I can't ever play because when I wake up in the morning, I hurt and it's pain going down my leg, I'll give them gabapentin at night and they can sleep better and they have less pain. Epidurals make a lot of sense, and it might sound scary to people, but it's not. Epidural injections, you know, the way I like to teach it is if your wife or if you are a lady watching, you had an epidural, it's a really big needle that an anesthesiologist sticks in your back in a dark room with no x-ray guidance. We take a very tiny needle, we do it in a bright room with x-ray guidance. A lot of times we'll give you sedation, so you just take a nap, and it's literally, they don't feel very much at all. And we can put medicine right down by that bulge, decrease the inflammation, and patients feel better. Right. So this is one of my favorite patients, is that radiating pain.
But we have to also let them know for patients who are diabetic, and they're not able to do any steroids. We do have different options. We can go with Tramiel injections. That's like a non-steroidal anti-inflammatory. It's more on the naturopathic side, but it does the trick.
So Bea knows about that. She worked with me in the procedure suite for 5 years. And so we took care of patients when they needed procedures. And so not every patient needs a steroid. We can put natural anti-inflammatories in the epidural space too, and decrease the inflammation without giving them a steroid, which, like you were saying, could be bad for diabetics. And so we're kind of running out of time. So give me one last patient that's like severe that you've seen recently.
So this last patient is actually one of our nurse practitioners' husband. So he has always played golf, and as a matter of fact, he wants to continue to play golf. However, he has severe spinal stenosis. I think it was at L4, L5.
Wow. Okay. That's not fun.
No, not fun. He actually has like weakness down his legs. Some sensation, it's pretty intact, but there's some decreased sensation there.
And how's it affecting his golf game?
There is no golf game.
I
mean, we want to help him, and I think we can let everybody know that we do have options for that.
Yeah, so spinal stenosis is tough. And my guess is you guys see a lot of this. Those patients have real back pain, where it's these patients classically, we call it the shopping cart sign. When you go to the store grocery, you kind of bend over it because when you do that, it takes pressure off. We have 3 levels of stenosis, and because of time, I'm not going to go too deep, but it's mild, moderate, and severe. The severe patients, we typically send those out to surgery. But what I tell people is, you know, most people don't have severe stenosis. Most people have mild or moderate. And if it's mild or moderate, that's something we can actually help you at our clinic. So we can do epidurals like we talked about before. We can even do a new procedure. And I recently made a video on this. It's on our YouTube channel, where we open up the space from behind. It's called a spinous process spacer. So if you push on your own back, the bones you feel right there, they're just beneath the skin, only about a centimeter below it. We can go in and open up those spinous processes. I'll actually show you on the model here. You can actually go in now, and we can do this where we go in between these 2 bones and we just open it up enough that it takes pressure off of the nerves. And so this procedure, people can get back to golf in 6 weeks. And we've helped a lot of patients. It's mostly for mild or moderate. We'll do it in severe, but typically when they just absolutely don't want to have surgery. So even spinal stenosis, even severe spinal stenosis, we're getting people back to playing golf. So thank you guys for the clinical stuff. What we'd like to do is take some questions. Austin, do we have some questions coming in? Do you want me just to walk over there and read it? Let's see here. So where would you like me to start?
We could do.
Okay, question. Is there anything additional technique-wise someone who's had lumbar fusion should do to protect themselves, assuming they are fully fused? In other words, should Tiger have done anything differently? So this is a good question. I guess I'm just going to stay kind of here for this portion. I'll handle this one. You know, it's interesting that you asked that. We designed a program at Arizona Pain over the last couple of months called ISO, Improving Surgical Outcomes, because this is exactly what we're looking at, which is how can we improve someone's rate of fusing? So a couple of things. One is pre-op, you should stop smoking if you're a smoker. It should never go into fusion surgery or any major surgery as a smoker. You should stop, get off. Their doctors can help you with drugs like Chantix. So don't go into any major surgery as a smoker. That wasn't Tiger's problem. Number two, you should get down as close as you can to your ideal body weight. Definitely get to a BMI less than 35 before a fusion surgery, because if you're overweight, it's shown not to fuse as much. Number three, you want to avoid NSAID. So the same thing we talked about, ibuprofen, but even Celebrex. You don't want to take that leading up to surgery because it makes you less likely to fuse. If you have diabetes, you want your hemoglobin A1C to be less than 8. If you take pain pills, we like to reduce the dose of pain meds before surgery because it's been shown statistically to show a better outcome post-op. So these are a few of the things. And the last thing is supplementation with vitamin D and calcium. And so if you do all those things, then you're going to have the very best chance of having a good fusion. And then as far as when you can play golf, I would work with your surgeon probably 4 months later. So it's a long turnaround from a fusion. And then you want to start with putting first, and then chipping, and then finally full swings. Let's take another question. What can I do when my golfing seems to induce sciatica on a more regular basis than it used to? Is it time for an injection? I'm going to defer to Dr. Moore on this. You probably get this question primarily when they can't play because of sciatica. When do you treat it and when do you send for an injection?
Yeah, it's tough, right? I mean, everyone wants to know, when can I get green lighted? How soon can I play? And we always have that risk to benefit conversation with the patient. And again, you got to walk before you run. And so we usually try to get the patient hitting some balls first, going through, working. And, I think one of the main things that we can, easily gain from today is you got to start working on your swing.
Yeah.
Right. I mean, if you're going back and doing the same movement that's causing inflammation, that inflammation is going to come right back. And so you'll be back sooner than later.
Right.
And so typically, after you do the injection, medication's in there a week, but the results can last a lot longer than that because you've reduced that inflammation. The injections typically last until the inflammation comes back. Right. And so if they're going right back into that improper mechanics, it's going to come back.
Every patient is a little different, but for me, there's no rule of thumb exactly on when to do injections. It's basically when we've done all the hands-on treatment,
Right.
we try the conservative care. Dr. Moore's worked with you maybe a month and you're still hurting and you're not playing, then I'll start talking about an injection. I think it's pretty low risk in the big picture. And so that's how we handle that. This is an interesting one. Thoughts on CBD balm? It's good timing. We actually talked about CBD last night at our provider meeting. And, long story short, I'm not going to go crazy into this tonight, but I have a son that has a severe seizure disorder, and he's been on CBD for years for seizures. There's a lot of research showing that CBD, specifically cannabidiol, is one of the molecules that's in the marijuana hemp plant, can help with seizures, but can also help with pain, can help with anxiety, can help with sleep, can help all these things. So I've been researching it for a long time. We're actually working on some products this year that we're going to have for patients. So probably over the next couple of months, be looking for that. And if you want more information, you can reach out to us afterwards. Also, what's the easiest way if they need more information that they can reach out? Is there
info@holisticpain.com.
So you can reach out to or send an email to info@holisticpain.com and we get you more information on CBD as it comes out.
And I'll tell you that CBD balm and CBD in general is getting massive on the PGA Tour, every tour. A lot of guys play it, and it's something I've used for years. Simple sore muscles, aches, pain, simple things like that. I swear by the stuff. I can't tell you the last time I played around the golf and didn't use it that night somewhere.
That's
So
awesome.
love it.
That's awesome. Okay, one more. Are there any more questions or just one more? Oh, there's someone on the side. Okay, let me give you this one. Good evening, all the way from Fort Bragg, North Carolina. I'm active duty Army. Thank you for your service. And I've been injured in my low back and I have 2 discs that are hurt with bulges on them. I've been playing golf since I was 4. I'm 26 now. I'm lost in golf at the moment. I want to change my swing to put less pressure on my back. So I think I'm going to answer that and then maybe turn over, to Scott or Mark to kind of answer. But if you have bulging discs, the most important thing is to make sure you get an MRI, that you see a medical professional that can tell you, is it a small bulge that you're probably going to be fine and you work with, Dr. Moore, or is it a large herniation? Sometimes the word bulge is not always clear. But assuming you have like medical clearance, someone's got pain in their back, what would be the first thing, Scott, that you would do to tell them to put less pressure on their back?
Well, the first thing is, what we talked about, narrow the stance, get the front foot flared.
Yeah.
So but a lot of golf instructors have gone, or many of them gone through this phase where they're trying to get the full 90-degree shoulder turn, but restrict the hips. And people with bad backs need to turn their hips more.
Got it.
Arnold
So
Palmer.
turn their hips
Yeah,
more
they
to
gotta
put less pressure on the
Then I
back.
still get a 90-degree shoulder turn, but I don't have the torque on the spine.
Yeah,
And make sure the hips get all the way around, at least 90 degrees back the other way.
that makes sense. So if he's changing his swing, narrow it up a little bit, make sure he's getting his legs to
Right.
touch,
He's got to
make
turn
sure
going
he's
back.
turning more on the back
Right.
swing. And then what you said before, not over rotating. That's a pretty good start.
Right. I mean, a lot of these instructors are trying to keep the hips immobile on the back, so
Yeah.
just thinking they're going to get more torque
Right.
out of the muscles, which I don't know, it could be true, but it can't be good for your spine.
So that X, where they talk about the X factor, where they're trying to increase the distance between the shoulders and the hips. And that might create more club head speed, but it also creates more injury.
Right.
And so if you're looking to enjoy this game at 26 for the rest of your life, then you got to start to do some of these things that put less pressure, less torque on your low back. You're still gonna have a lot of fun. You're still gonna hit the ball a long way. Do you want to tell them what you told us earlier about the difference between swinging 100% and
Yeah.
75%?
It was, this was something that was, it was like a big slap in the face to me. When I was still playing professional for a lot of years, I was on Ping's staff, and I was down specking out some new clubs. And this was back when TrackMans were, 50 grand each, and they were impossible to get, but they had TrackMan down at Ping. And I said, I just want to see the difference between swinging 100% and swinging what I felt like was 75%. And so I went full bore, hard as I could go at a 6-iron. And my full bore, hard as I could go at a 6-iron was 203. And
That's pretty big. I
Made me
think you just
feel-
told this story to
Yeah.
show off.
that's it, I make 160 pounds of really large. So it was 203. And so I dialed it back and felt like, all right, what's it going to be if
Right.
I feel like 75%?
150.
And exactly, right? That's what it should be
Right.
about. 197.
Wow.
So me feeling like I was taking a lot of pressure out of it, like I was taking a ton of tension and this really bulking up trying to murder
Right.
it. All of a sudden we're talking, 20 feet. And like Scott and I were talking about earlier with this, not only that,
Yeah.
but the dispersion is going to go from here to here. And all of a sudden you're hitting it a whole lot more solid. So what you're
Do you
giving
agree
up
with that,
600
Scott?
Oh,
Swinging
absolutely.
easier?
I mean, there's going to be a lot of diminishing returns on club head speed for everybody. So you're going to get to a point where it's pretty accurate, and then you go that extra 2 or 3 yards and you can't control it.
Right. So the take home for the viewers at home, you don't have to swing at 100% as hard as you can all the time. You can swing at 80%, 90%, even 75% and still get a lot of distance, and it's less pressure on your back. And so that was really helpful. We got a few other questions. When can I get an appointment with Dr. Lynch on a Tuesday? That's a great question. In the afternoon. If you're my friend, you can reach out to me and I'll make it happen. Otherwise, you can call our phone number 480-563-6400 and tell me you want to see me and they'll get you in. We got some more questions. This is good for you, Dr. Moore.
All right.
How can you tell after an injury when you're ready to play golf again?
Yeah, no, I think that's great. We talked a little bit about that, but with the symptoms, we definitely want to make sure no more leg symptoms. That's, I think for me at least, that's the kind of line in the sand. If you're still having some leg symptoms, it's too soon. It's too early. If you're having some low back pain, I think getting a good stretching program, and then you can start to basically, like the weekend warrior, you're getting to the course early enough, you're warming up, you're not getting to the course and banging out 2 large buckets of balls. But if you think about it, how many balls, if you're hitting a bucket of balls compared to playing around,
Right.
how many full swings are you taking versus some chips and some putts? Even a not great golfer like myself, most of that is in the short game anyways, right? And so compared to just sitting down and not taking 10 seconds in between a bucket of balls and just knocking that out, that's a large load on the spine. And so oftentimes what I tell patients is just be comfortable just taking a few practice swings, warming up, getting some stretches in, and then just be comfortable playing 9 holes.
Right.
And if it doesn't feel good after 6, be comfortable saying that's it. We're done. And so I think a lot of people get geared into, well, I paid my green fee, I'm going to get my money's worth, and they're limping through those last, the back 9. And so, listening to your body and being cognizant of your symptoms is extremely important.
Well, I think it's something that we talked about before we went on tonight, that I think it especially when can you get back to playing golf? The most fun work that I get to do is when I get to work directly with somebody's teaching and, teaching pro and their instructor, along with their chiro or their PT or whoever they're working with. And so it's one of those that I think the kind of whole point of what tonight was is if golf is that important to you, not just having a huge team that you have to go and talk to everybody, but
Right.
a simple text from me to Scott on what's going on
Right.
with Alex. Hey, I saw this. Are you seeing anything? You know,
Right.
hey, you know what? Holler at his dad, see if we need to get him in, you know, have an adjustment or what's going on. And just having your own team that has no problem talking. And
Yeah.
hey, is he ready to go? Is he feeling good enough? He's moving really well. What's his swing doing? Does he have any speed? Does he, you know, and finding that kind of balance there.
We're gonna take a couple more questions. Austin, if you don't mind, will you read from there? Because I'm just gonna rejoin the team a little bit for the last couple of questions.
Yeah, so is hitting a few balls the best warm up, or should we be static stretching before starting?
Yeah, this is a good one for you, Mark. So do you hit a few balls or do you stretch?
So anytime that we warm up, same that we were talking with Chase over here, I want movement. Static stretches before we play are actually going to build tension. They're not really getting you loose. Moving, I would rather see somebody doing jumping jacks before they go and hit golf balls than just
So
reaching forward.
dynamic
Exactly.
motion. Okay.
Dynamic movement. And
I usually dance, like I'll do
Yeah.
a twirl.
Well, you're good
like-
at it.
Yeah, well, you know, I get low, getting low.
That's-
helps.
yeah, you get the shakes going. But no, before you play, I love people to have, I'm big on people having 10 to 15 minutes that they know what their body needs, whether that's hamstrings, whether that's shoulders, whether it's hips.
But
back,
10 to
whatever.
15 minutes. Most golfers, do they do that, Scott? What do they do? 2 minutes, right?
The weekend warrior walks up to the range and grabs the driver and starts ripping it.
Yeah. So 10 to 15 minutes, that's a take home for everyone.
Little stretch, and you can do
Yeah.
it at home. It doesn't have to be at the course and looking goofy on the range. But the other thing I talk about in warming up specifically is if you ever watch Tiger warm up live, you'll see him go through like easy lob wedges, so
Right.
very slow moving 9 irons, 8
Right.
irons, you know, short irons getting in. You won't see him go after one, and this is true for most tour pros,
Right.
until they're getting into 3-woods drivers. You're not seeing full hard as I can go swings until they know their body's prepped and ready to play. And so everything that you're doing on a day that you play golf, from the minute you wake up until you get to that first tee,
Yeah.
is prepping the body. So, you know, some movement, some simple stuff at home, maybe some simple things when you get to the golf course that, you know,
Yeah.
bring in that movement and that dynamic motion, and then getting into hitting balls nice and easy, finding a rhythm, finding fluidity before you start going full bore at it.
Saw a couple-
Bud Light or Kettle One.
Yeah, Kettle One helps too. It kind of gets you
Little
relaxed.
lube.
I'm gonna take just a couple more. I saw one actually as I was walking over. What's the mechanism of action of CBD? Because we talked a little bit about CBD. It's such a good question. I would tell you that probably 80% of physicians don't really understand CBD or marijuana or how it would work. But there is very, very good data now, if you want to research it, on what's called the ECS, the endocannabinoid system. And so the ECS is a real thing within our bodies. We call it a neuromodulating system because it modulates neurotransmitters that are already there. So a classic neurotransmitter that people understand is like dopamine. So dopamine, if your child has ADD and you need, I'm not saying I need this medication, if you guys are saying that, but some people need Ritalin, and that increases dopamine in your frontal cortex. And so dopamine is released and it hits a receptor. What CBD does is it's almost like a volume switch. It turns up or down how your body perceives that dopamine. So it's not the actual receptor that's going across, it's modulating on the side of the receptor, just like your radio. So it's a modulating system. It puts us back into balance. And that's why CBD makes people calm or lets people sleep better, and also decreases pain, decreases inflammation. So if you really want to learn more about it, go read about the endocannabinoid system, or the ECS. We just discovered it about 35 years ago, but it's every bit as real as the circulatory system or the nervous system. Maybe one last question, Austin.
So this is for Scott. Thomas Torres worked with you a long time ago. Do you do lessons over video or just at Papago?
Everything I do for the most part is at Papago, but I have people send me videos periodically. One from Singapore once was a mini tour player that was over there, was struggling. So yeah, I mean, they can just get in touch with me and I'll tell them what kind of camera angles I want and I'll take a look at it.
That's awesome.
Let's do
One more. Okay,
Two
yeah.
questions.
Yeah.
And you answer it how you want. How soon after procedures can I play? You touched on that with a specific procedure earlier. And do I need continued chiro after a procedure for strength?
Yeah, it's a good question. So let me answer that one. I'll bring you in a little bit, but how soon you can play after procedure depends on the procedure. We do one procedure called a medial branch block, which is just a diagnostic block to see if your pain's coming from the facets. you could go play that same day. We just numb it, it gets better in 2 or 3 hours, you could go play. It's very low risk procedure. Then there's a spinal fusion that would be done by like a surgeon, and he may not want you to play for 4 months or 5 months. And so it kind of depends. As far as after a procedure, once your physician releases you, I would say we would always want you to stay with the chiropractor.
Yeah, absolutely. And, you know, it's not indefinite care, but unfortunately, you know, depending on how much you're playing and the load, you know, and the lie angle, or, you know, you just chunk one. I mean, you can tweak yourself. And so that's, you know, we get those patients as needed basis.
I think if we're honest, most athletes are constantly working on their bodies, trying to keep their bodies strong and not get injured. And we're constantly a little bit hurt. You hurt your wrist, you hurt your back, you hurt your shoulder. And I think you need someone like Dr. Moore and the team. Dr. Moore has been treating me for 14 years. And I would say I probably see you 3 or 4 times a year.
Right.
It's not every day, it's not every week, but today was one of those
Absolutely.
days.
It was a day.
And when you're hurt, it's nice to have someone like Dr. Moore that's going to work with you. It's nice to have someone like Mark that can strengthen you and keep you from getting hurt. It's nice to have Scott on the team to show you how to do it. So with that, I'm going to finish. I'm going to just say a few remarks. One, if you're a patient and you're hurting, reach out to us and we'll see you. I'm seeing patients, especially COVID's getting better now. We're coming out, but there's still some concerns. If you haven't been vaccinated and you're worried about coming in, I'll see you by telehealth. Almost 50% of our visits last week were still telehealth. So if you want to be seen, you can come in and see me in person, or you can see us on telehealth. You can call 480-563-6400, or you can just go to arizonapain.com. It'll show you how to get an appointment. You can actually fill out a thing there. So if you are a patient, you're hurting, reach out to us and we'll help you. If you are a golfer and you want to get better, I would definitely recommend that you reach out to Scott Watkins. What's the best way to contact you?
If you just looking for information or want to schedule, it's through my website, which is scottwatkinsgolf.com. Or if you want to call me or text me, it's 602-330-4217.
And you can reach out to me too if you need to get a hold of Scott. And if you're looking for someone that will help strengthen your back and your other muscles to prepare you, I would highly recommend you reach out to Mark Williamson. What's the easiest way for them to get a hold of you?
Easiest way is probably text, phone call. My number is 480-239-6094. Another way is through Instagram. I'm at the Golf Yogi on Instagram. Easy to get a hold of. I have a lot of people that I message with that way as well. So yeah, either of those.
Awesome. I appreciate everyone that watched us tonight. We're going to probably end up doing a monthly webinar series. And so this was our first one. I hope it was really educational for you guys. I hope you learned a lot. God bless you guys. Have a wonderful night. We'll see you soon. I hope you're bombing drives 300 yards while protecting your back. Good night.